So here we offer the ER, of course. We offer all those little outpatient things like lab or radiology and physical therapy. We have a very good physical therapist here. And then we also have respiratory that you have to have, you know, if you're going to take care of ER patients. We have the Green Oak Behavioral Health Department here. That is for geriatric patients 55 and over. So we take care of those. We also have an outpatient geriatric psych program that the patients actually come into the building, and we have group and that kind of thing with them. Well, and here especially, you know, we see a lot of diabetes, of course, COPD, those kind of things, those respiratory issues that come up. We also, some of the kids that we see are teenagers. We've got mental health. Mental health is a big area that we're trying to focus on now. We see a lot of mental health in our ER here. From here, we usually try to transfer them out and that kind of thing, or admit them into our Green Oak unit if they're age appropriate. Well, here we've got several outpatient clinics that are, well, we have one right over here that's affiliated with Ballad, but there's a few other outpatient clinics downtown. A couple of the physicians are privately owned, and they have their own business for taking care of patients. Unfortunately, we don't have a very good mental health background here. We've got the Dickinson County Behavioral Health Services over in town, and they try to help make sure that those patients get the care that they need, because behavioral health, you usually have to send them away to another town or something to get that care.
We have outpatient counseling, which we bill Medicaid and private insurance, and it's also self-pay. So outpatient counseling is here in the office. It's an office setting. We can also provide it in the schools, and we prefer here though, because it's kind of, we keep our materials and things. But we hope to get into the schools after COVID dies down.
Yeah.
And we can actually see the clients there without them having to miss school. We can just see them, and they don't, not out the rest of the day. So we also provide, we branded it Counseling to Go. And that's because it's a wraparound service that allows us to provide counseling in the community. We can go walk the track. In their homes, we can go in the homes. We can see them in the schools. We can go to court with them. We can do family counseling, parenting. Our brand is Counseling to Go, and some people call it in-home, but it basically allows us to meet the client's needs wherever they are, and we're not confined to an office setting. So, well, it kind of goes hand in hand. I'll tell you what we're seeing more of is entire families. Entire family systems are being affected, greater than I've ever seen before. And so, yes, we're seeing more children. Yes, we're seeing more adults. I'd say about equal. That is what I have seen the greatest impact on, is the family system in general has been hit hard with COVID. Yes. That is more on our side. So that's more on us. Because obviously, if we're paneled with an insurance, if we're paneled with Aetna, we're paneled with Anthem, they're going to come to us, really. If we're not, we're when we first started, we were one of the few in the area taking new Aetna clients, for instance. So we had a ton of those referrals. But So yes, it does impact it, but it's not really on the client. That's on us.
Okay.
We need to make sure we're paneled, and that is not an easy process. That is a
Right.
terrible thing, and to try to get paneled and work with insurances, and it is a full-time job to manage credentialing and paneling so that you can provide services. It's probably our greatest challenge.
Yeah.
Welcome. My name is Haiti Robinson, and I have lived in Dickson County for approximately 40 years. So I've been the superintendent in Dickson County for about 13 years. Right now, I think it's just the mental and the social, emotional things with youth. We are just seeing a lot of children with emotional needs, behavioral needs that are, I call them at the next level, all right? And then when you see their families, you understand because families are hurting and they're suffering. The other thing that I'm very concerned about is just the learning gaps. You know, we have first graders, second graders that have never been in school. Okay, they don't know how to read. They don't know how to communicate with people. They don't know how to interact. I mean, just the academic gaps in children, missing that much instruction, and then also the social emotional needs of children and their families is quite perplexing. So I think the barriers would be just more to have the appropriate and the number of agencies, mental health agencies, organizations to help our families. A significant number of our families do not have those resources.
Okay.
Okay, there are families that do. Probably your families do.